So, hi everyone. Thank you so much for joining us today. We have a really special guest, Dr. Aldona Spiegel, who I've known for it seems like 15 years. We met at an amazing conference in Sonoma where we discussed the most cutting edge techniques in reconstructive breast surgery. And I'm sure she's going to tell you how those now seem like techniques that are very, very old and ancient. But she is a world-renowned expert in plastic and reconstructive breast surgery, microsurgery. She's done 4,000 operations. She studied under the very well-known Bob Allen, who is one of three people that actually developed the DIEP flap. I was lucky enough also to be his breast surgeon for many years in New York City. She did all of her undergrad medical school in Canada at the University of Ottawa. After that, she went to the famous Hopkins for her residency and then Baylor for her fellowship. These are not easy programs. In addition, she does advocacy, something called Pink Sisters, which I'll let her talk about. She's, like I said, an expert and speaker. She's published more times than I can even describe, maybe 6 or 7 pages of publications. She's contributed to book chapters and full books, as well as speaking engagements, as I mentioned. So welcome, Aldona. Thank you for joining us.
Thank you so much, Rachel. It was really lovely to circle back together. And thank you so much for inviting me to your learning series or podcast, I think.
Thank you. I want to say one more thing. The field of plastic surgery is vast and very artistic. And, people choose specialties for all sorts of reasons, all of which have some, are noble. But in my opinion, two of the most noble fields in plastic surgery and in all of surgery include burn reconstruction and breast reconstruction. And I would say you haven't just done some breast reconstruction. There are a lot of plastic surgeons that do some. You have gone all in. You've dedicated yourself to breast reconstruction. And that's what makes this call so exciting, because our audience is going to hear about procedures that they'll never find easily in a book, although we'll teach them how to find that too. But again, Dr. Spiegel sitting here with all sorts of incredible advances in the field. So I wanted to just talk first about the different types of reconstructions. If you could just start basic and tell everybody what you do,
Absolutely. So, I'm very passionate about breast reconstruction and kind of thinking back about why you would choose that as a plastic surgeon. I think breast reconstruction is a really amazing combination of both artistry and technical mastery, because you really have to understand the three-dimensional kind of structure of a breast, almost like an architect. And then there are some procedures that are quite demanding technically when you're utilizing the patient's own tissue and transplanting that. So those are microsurgical procedures. But also there are others that, you may not have enough tissue elsewhere, or a patient may not want that type of a complex procedure. So we would term those as implant-based procedures. So those are really the main two procedures that we usually talk about. So when I start talking to a patient, I really want to know what their, first of all, idea is about reconstruction. Many patients have a lot of preconceived ideas. Sometimes patients, think it's like augmentation. They sort of say, my friend had an augmentation and, 2 days later she went back to work. And so there's a lot of ways that we have to really educate patients to understand how we're starting, because it is a complex topic and there are a lot of procedure options available.